What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we will be covering the difference in the workspace or work area of an Xray Tech versus a nurse. So, to give you a rundown, I am an Xray Tech. I've been doing X-rays for about 4 years certified, and then another year at the same facility I work at, so 5 at the same place. And then my lady is a nurse. She's been doing it for I think 7 years. Yeah, like 7 years, and she's done various different locations because I know nurses are needed in quite a few other locations more compared to the Xray Tech. But just giving you a rundown of what to expect, the difference. So as far as the tech goes, we are usually in the room where our equipment is, in the back, usually in the big room where we have the consoles, the computers, the workstation type thing. Usually that's where we congregate at. I know some smaller sites, some of the techs may be at the working, like at the nurse's station, just chilling up there. Other times, they have their own little stand area next to the portables. And then you have the main radiology department that they'll be at, or the ER, different zones, or the patient outbuilding, depending on where you're at your office. And I know some clinics, both the nurses and the X-ray, little working areas kind of together, where all the tables are. I know that happens at smaller sites or at clinics. So that's kind of a rundown where I guess both kind of meet together type stuff. So that's usually where we are. And then my lady as a nurse, usually, once again, depending on what you're doing as a nurse, she did a while back, home health. And that one, well, you're in your car. Same thing with mobile X-ray. You're in your car. You just do your work like that. And then she had home health. Family medicine. So she had her own little cubicle next to other people, her little cubicle. But she was kind of designated to either answering the phones or being a personal nurse to a doctor or physician or nurse practitioner or whatever. So she would have her own little station, which us as Xray Techs, we kind of don't have that. It's this is everyone's type stuff. You may get a locker type, that'd be about it, but you don't have your own little work just for you station. It's everyone uses it. People may have where they sit, but that's kind of about it. And occasionally I'll see more the CAT scan people will be more where the nurses and doctors are, because I know that with that modality sometimes it kind of gets it's more in depth, more stuff, more variables you got to work with between blood work, creatinine, and a bunch of other stuff depending on what they want to see. Different exams will be ordered, different things, and sometimes it's easier just to be there. So if they're hey, I need a CTA of, what do you want? This and that, and then the tech kind of look at the patient. Sometimes they'll be oh, you need this, or change it to this, and stuff like that, kind of like that. So that's kind of the gist of that. And then I know usually there's more nurses than there are techs at most facilities, depending. It can range from one. I worked the other day at my smaller, it's a branch. It's the smaller ER of the main ER type thing. So it's on the opposite side of town. That one, at nighttime, they just have CAT scan only. So it's just one tech versus I think 8, 9 nurses. And 2 or 3 doctors. And then the afternoon shift, there'll be an Xray Tech, and there'll be a nurse. Xray Tech, and then there'll be a CAT scan, and there'll be slightly more nurses, slightly more doctors. But we're all kind of congregated in their own separate little stations type things. Usually that's how it goes. So it's not bad, I would say. I mean, it all depends on how big your hospital, and then like if you know people, some techs or some nurses are more. Mainly the techs will be the ones who go to the nurse's station, because like unless you have someone that will peep in and wants to hang out with you, they're not really in the Xray Tech place, because like I mean radiation and all that. So they try, limit the dose of stuff. So that's kind of the gist. I mean, some techs will be up there because they know people or they get along with the doctors type stuff. So they may be there, but most times we're all in our own little huddle in the back. But yeah, that's been your boy Miguel. Hope you enjoyed today's video. See you on the next one.